Hi, my name is Kayla Petzold, and I researched the human prion disease, Cruetzfeld-Jakob Disease, better known as CJD, for this project. Prion diseases are a group of fatal neurodegenerative diseases that are caused by prions and are often referred to as transmissible spongiform encephalopathogens, or TSCs. Normal form of the prion protein is found in the body, while the abnormal form takes a different folded shape and is what causes the disease. Cruetzfeld-Jakob disease is a rare, degenerative, fatal brain disorder and is the most common of the known human TSCs, with about 300 U.S. cases each year. Usually it appears later in life, with the onset of symptoms about age 60, and runs a rapid course, with 90% of individuals dying in the first year. There are three categories of CJD. Sporadic CJD is the most common type and occurs when the disease appears, even though a person has no known risk factors. This category accounts for 85% of all cases. Hereditary CJD occurs when a person has a family history and/or tests positive for the genetic mutation associated with CJD. This form accounts for about 5 to 10% of all cases in the U.S. Acquired CJD occurs when the disease has been transmitted by exposure to infected brain or nervous system tissue, usually through medical procedures. Since first described in 1920, fewer than 1% of cases have been acquired. Symptoms of the disease are characterized by rapidly progressive dementia. Initially, patients will experience problems with muscular coordination, personality changes, impaired memory, judgment, thinking, and impaired vision. As the illness progresses, mental impairments become more severe. Patients often develop involuntary jerks and may go blind, will often lose ability to move, speak, and will often enter comas. Patients are more susceptible to infections, which often lead to death. Symptoms of CJD are similar to neurological disorders such as Alzheimer's and Huntington's. However, CJD tends to cause a more rapid deterioration of abilities and causes unique changes in brain tissue. There are several variants of CJD. New variant CJD has been described in Great Britain and France and begins primarily with psychiatric symptoms and affects younger individuals than normal and has a longer than usual duration from onset to death. Another form, found primarily in Japan, runs a relatively long course with symptoms progressing over several years. There is currently no single diagnostic test, only tests that will rule out other treatable forms of dementia. For example, spinal taps, EEG, MRI, all reveal characteristic patterns of brain degeneration. The only way to confirm a CJD diagnosis is by brain biopsy or autopsy after death. For biopsy, the surgeon removes a small piece of tissue from the patient's brain. However, this can be dangerous and does not always obtain a sample of the affected tissue, so it is discouraged unless needed to rule out other treatable forms. Both biopsy and autopsy pose risks that the surgeon or others in contact with the brain tissue may become accidentally infected. Special surgical and disinfection procedures are used to minimize this risk. Scientists are currently working to develop lab tests that are easier and safer alternatives to diagnose those showing symptoms. The leading theory is that CJD and other TSCs are caused by a prion protein. Some researchers believe that unusual slow virus or organism may be caused. However, never been able to isolate a virus in people with the disease. The agent that causes CJD has several characteristics that are unusual for known organisms. It is difficult to kill, it does not appear to contain any genetic information in the form of nucleic acid such as DNA or RNA, and has an unusually long incubation period before symptoms appear. Some cases can be as long as 50 years. Researchers believe that sporadic CJD may develop from a person's normal prion spontaneously changing to the infectious form of the protein and altering others in a chain reaction. The abnormal prion proteins aggregate or clump together and may lead to neuron loss and other brain damages. Hereditary CJD is caused by the mutation or change in the gene that controls the formation of the normal protein. If the protein is altered in the sperm or egg cell, then the mutation may be transmitted to offspring. The prion gene has several different mutations, and the particular mutation in each family affects how frequently the disease appears and with what symptoms. Cruetzfeld-Jakob disease cannot be transmitted through air or casual contact. Spouses or other household members of sporadic CJD patients are no more at risk than the general population. However, exposure to brain tissue and spinal cord fluid should be avoided. There is no treatment or cure to control CJD. The treatment that there is focused just on alleviating symptoms and making the patient more comfortable. Future research is focused on finding better diagnostic tools and confirming a cause for this disorder. Thank you.